Hello, I'm Dr. Scott Morris. I'm the founder and CEO of Church Health. I'm really sorry I can't be with you in person today, but I did want to just take a few minutes to talk to you a little bit about the role of Church Health in our residency. This is a partnership between Church Health and Baptist Hospital. There are a lot of fantastic things about the hospital. It is a large tertiary hospital. It has everything you can ever imagine that a hospital would have. I can assure you that your training in the hospital will be as good as it gets, only this is a family medicine residency. I'm assuming all of y'all want to be family doctors. So that to us is primarily an outpatient profession. So your experience here at Church Health is what you should care about. It's why you should choose our residency if you have an interest in what we do. Again, you're going to get all the training you need from the hospital perspective at Baptist, but I think that'll be true at really any residency you're applying to. For me, the hospital is the hospital is the hospital. It's the outpatient component that is different. So why is Church Health different? So we've been around since 1987. Our mission is to provide health care for people who work in low-wage jobs who don't have health insurance. So we take care of the people who work to make our lives comfortable. They cook our food, they take care of our children, they wash our dishes, they cut our grass, when they dig our graves, they don't complain. Yet when they get sick, their options are very few. We saw 12 people the first day we were open. We've grown to where there are over 70,000 people in Memphis who depend on Church Health for their health care. So we are the largest faith-based, privately funded health center in America. There's a lot of disclaimers there. But the point of this is that our mission is to provide whole person health care for people in low-wage jobs, and we do it under the umbrella of the faith community, that the broader equitable, ecumenical faith community, so Jewish, Christian, Muslim, Hindu, we don't care, but we do believe that engaging the faith community is central to who we are. I happen to be a Methodist minister as well as a family practice physician, and we do this work because every world religion, and I will say especially from a Christian perspective, we're expected to do two things: care for our bodies as well as our spirits, and to care for the poor when they're sick. So for that reason, we're not a federally funded anything. We're not an FQHC, a federally qualified health center. You'll be applying to other residencies, which they are federal clinics. That is not us. We're a true charity. We have to raise over $20 million a year to keep our doors open. And part of the way we do what some people refer to as Church Health magic is we have over 1,000 physicians who volunteer with us. That's not a made up number. So when you're a resident and you need a cardiologist, you're not going to have to worry about, will Medicaid pay for it? The best doctors in Memphis will be volunteering to see that patient. Now, to really understand our work, though, and why you ought to care about coming to us, you have to understand our view of health. So being healthy is not about the absence of disease. The World Health Organization would agree with that. Who cares if you live 2 years longer, if it means 2 years longer in a nursing home? Life for life's sake can't possibly be the point. Breathing in, breathing out, none of us are signing up for that. So what we would argue we should care about is three things: having more joy in your life, having more love in your life, and being driven closer to those things greater than we are. Now, we would call that God. You don't have to call that God. But there are things greater in all of our lives than just us. So those three things, more joy, more love, and being driven closer to things greater than we are, that is what leads to all of us being healthy. You, me, our patients. Now, if that is the point, then it doesn't have a lot to do with the doctor, does it? So how does that implement itself? What are the practical applications to that concept? Well, it led us to create something we call the model for healthy living. So we would argue that there are 7 things in life that are equally important to life that are in balance, and all must be addressed in order for somebody to be healthy. So medical care is one, but it's only one. Our country is spending almost $1 trillion a year on healthcare, and yet it has only a 10% impact on our health outcomes. You could argue maybe we're not spending the money wisely. But look, that is one, and that's a big part of what you're going to be participating in. But there are other aspects. Nutrition. Your mother told you you are what you eat. She was right. You come to our residency, we're going to have a lot of focus on nutrition. You're going to be connected to dietitians. We have an incredible kitchen. We will turn you into a chef. We are very focused on culinary medicine. Food is medicine. If that's something that attracts you, then our residency ought to really ring home to you. Movement, our bodies were made to move. Church Health's YMCA is literally contiguous to the residency space. You will have access to it, but more importantly, our patients have access to it. Plus, we have physical therapy as a critical part of what we do. That's one thing that is really never available to poor people. Emotions, family and friends, work. We define work as those things that bring meaning to your life. And lastly, your faith life. So we would argue your faith life is as important as anything the doctor might do. So within the residency, we're not going to back away from the fact that there is a spiritual dimension to life. Now, what we are not about is imposing our faith and our beliefs on our patients. That we would never do that. But what we aren't going to back away from is that spiritual component to life. And within the residency, we're going to work together to understand how spirituality and medicine work together. We have a Yale Divinity trained young pastor who is part of our staff, who monthly will meet with you to talk about these issues of spirituality and health. Again, not to impose your faith, but to help patients understand how this becomes a strength in their own life and how you as a physician can help make that happen. So within our clinic, all of these things are embedded. There are counselors. We have a behavioral health center. You'll have a counselor immediately available to you at any point. You don't just make a referral. That counselor can come in right away and work with your patient. Dietitians, health coaches, these things are all part of who we are, and it will impact the type of doctor you're going to become. Now, rather than me just keep talking, I'm going to show you a video, or Collins is going to show you a video of our building, which is a unique aspect of Church Health and this residency. Our building was once a Sears distribution center. It's 1.5 million square feet in size. It's a big place. It was abandoned in 1992, but it has been fully restored. And Church Health is the anchor tenant, and this video will tell you a lot more about it. So again, I hope that what I've said to you appeals to you, and that's the type of doctor you want to be. And I look forward to at least having one or more of you match with us. So no matter what, good luck, and have a great day.